Alzheimer's disease is the most common form of dementia, a neurodegenerative disease characterized by a progressive and irreversible loss of cognitive functions due to the death of brain nerve cells. Alzheimer's disease is generally divided into 4 phases that reflect the progression of symptoms and cognitive deterioration. In the last video, which you can find by clicking above, we saw the prodromal phase and the initial phase of Alzheimer's. That is when the first signs and symptoms of this neurodegenerative disease appear. In this video, however, we will see what happens during the intermediate or moderate phase of Alzheimer's. This is the longest period, which can last on average from 2 to 10 years, before moving on to the terminal phase of the disease, which we will see better in a future video. The intermediate phase of Alzheimer's is characterized by a worsening of the symptoms found in the initial phase, significantly affecting the daily life of the patient, who is no longer able to carry out normal daily activities. Amnesia. Memory loss is the characteristic symptom of Alzheimer's disease and is due to a series of pathological changes in some areas of the brain, such as the hippocampus and the entorhinal cortex, that interfere with the function and communications of neurons, leading to their death. If in the initial phase the memory loss is mild, during the intermediate phase it becomes more evident. The disease not only affects short-term memory, but extends to other regions of the brain, also affecting long-term memory. It is a sort of warehouse with almost unlimited capabilities, where all the experiences and knowledge acquired over the course of life are stored. The alteration of long-term memory in the patient suffering from Alzheimer's disease causes difficulty in recovering memories and past events of his life, such as birthdays, weddings, and other important events, but also the telephone number, home address, or school he attended. Agnosia. In the intermediate phase of Alzheimer's disease, what is called agnosia tends to occur. That is an inability to recognize already known objects, people, shapes, smells, and sounds, even though the perceptive abilities of the patient suffering from it are intact. There are different types of agnosia, and they can affect each of the 5 senses. Visual agnosia is frequently encountered in Alzheimer's patients, in which there is an inability to recognize and identify objects or faces, despite there being no damage to vision. Instead, it is the result of damage to those brain areas responsible for processing and interpreting visual information. The patient is unable to recognize commonly used objects, such as a fork or pencil. If he touches them, however, he can recognize them. In the intermediate stages of Alzheimer's, what is called prosopagnosia arises, an acquired perceptive deficit of the central nervous system, in which we are no longer able to recognize the facial features of people we know, and in the most serious cases even our own face, when we are in front of a mirror. It is undoubtedly one of the most destabilizing symptoms for those who suffer from it and for those around them, because it makes strangers the people with whom we have shared an entire life. The brain of the patient suffering from Alzheimer's no longer recognizes the people dear to him, but they always remain in his heart. Another type of agnosia found in the intermediate stages of Alzheimer's disease is topographical or environmental agnosia, in which the patient is no longer able to recognize and orient himself in familiar places, such as his own home or the city in which he has always lived. For this reason, he must always be accompanied by someone when he leaves the house, in order to prevent dangerous situations and therefore guarantee his safety. Wandering, for example, is a typical behavior of Alzheimer's patients, which leads them to wander the streets aimlessly and without a specific purpose. It can be triggered by the desire to look for something or someone, such as a friend or family member, but also by stress, boredom, or physical and emotional needs, such as hunger or the need to go to the bathroom. The various types of agnosia in Alzheimer's disease can vary considerably from person to person and manifest themselves with different intensities. During the intermediate phase of Alzheimer's, the need for supervision and assistance in the daily activities of the affected person increases, for example, for the preparation of meals, for household chores, but also for taking medicines, for taking care of personal hygiene, and for managing finances. Apraxia. During the moderate phase of Alzheimer's, the patient's motor impairment becomes increasingly disabling, also increasing the risk of falling. In medicine, we speak of apraxia to indicate a neuropsychological disorder of voluntary movement, characterized by the inability to make coordinated gestures to carry out a specific action, despite the subject's will and motor skills remaining intact. The patient may not remember how to dress or wear them backwards or in the wrong order, how to hold a fork or how to bring food to the mouth, how to use soap to wash or a toothbrush, but also leaving the stove on without food or even eating raw ingredients. These apraxic disorders prevent the Alzheimer's patient from carrying out normal daily activities and seriously compromise his autonomy, thus making constant supervision by another person necessary. The apraxic disorder is added to the amnesic, agnostic, and other disorders of the cognitive and emotional sphere, thus making the situation even more confusing and problematic. Aphasia. If in the initial stages of Alzheimer's, the patient may experience difficulty formulating complex sentences and finding the right words during a conversation, in the intermediate stage, the aphasia becomes increasingly evident and disabling. It is an acquired language disorder that causes the partial or total loss of the ability to compose and understand language, written or spoken, despite the absence of a defect in phonation or articulation of sounds. The patient suffering from Alzheimer's is no longer able to actively participate in conversations, even simply listening, thus making social interactions extremely difficult. The vocabulary of words that he has acquired during his life is reduced, and he tends to use increasingly simple and repetitive sentences. Reading and writing are slowly abandoned. Aphasia thus makes communication between the patient and the person who takes care of him difficult, and the cognitive decline of the patient is often associated with the emotional decline of the relative. The inability to communicate leads to what is called conversational unhappiness, a term that describes the sense of frustration, dissatisfaction, and above all impotence that parties can feel during attempts at dialogue. In conclusion, we have seen how in the moderate phase of Alzheimer's, compared to the initial phase, the patient becomes less and less self-sufficient and more dependent on constant supervision by another person to guarantee his well-being and safety. This is a phase with a strong psychological impact, also for the people around him, because they see the sick family member changing, but above all, different from how they knew him. His difficulty in recognizing his closest relatives amplifies the sense of loss and loneliness, adding further emotional weight to a journey already full of obstacles.